Let us see the menstruation. Menstruation is one of the natural process, one of the physiological process occur in the female. Actually, what happens during this menstruation period? Which hormones are responsible for the menstruation? There are the 4 types of hormones. They are responsible for the menstruation process: progesterone, estrogen, follicle stimulating hormones, and luteinizing hormones. Look at this figure on the screen as carefully. Okay, there is a period of menstruation. It lasts for 1 to 3 days. Period of regeneration from 6 to 13 days. Ovulation period from beginning from the 14 to 16 days, and period of secretion of blood in endometrium from beginning from the 17 days to the 20 days. Okay. Now let us see actually what happened there. There are the number of follicles are present in the ovary. Follicles what is that? There are the number of follicles are present in the ovary. These follicles start to develop along with oocyte in ovary under the influence of follicle stimulating hormone. This follicle stimulating hormone is abbreviated by FSH. It is secreted by the pituitary gland. This hormone is responsible to start the development of the follicles. During this developing follicles, these follicles secrete the estrogen hormones. And estrogen hormone is one of the most important hormones to develop the endometrium area in uterus. Okay. Meanwhile, actually what happened there? These follicles complete its development. It becomes burst under the influence of luteinizing hormone. These luteinizing hormones is secreted by also pituitary gland. What is the role of luteinizing hormone? The follicle burst. Okay. During the burst of this follicle, the oocytes are released from these follicles in oviduct. It is called as ovulation. So the ovulation is beginning from 14 to 16 days after the menstrual cycle and after the menstruation period. 14 to 16 days. Now look at this figure here. 14 to 16 days, that is the ovulation period. Ovulation is simply defined as the burst follicles release the oocytes in oviduct under the influence of which hormone? Luteinizing hormone. It is called as ovulation. Okay, the remaining this discarded tissue or burst tissue of the follicles form the corpus luteum. Form the corpus luteum. Is it clear? Corpus luteum. Corpus luteum. This is corpus luteum. This corpus luteum starts to secrete the progesterone. The progesterone is another one of the most important hormones. It is secreted by corpus luteum. How to form corpus luteum? Remaining discarded tissue or burst tissue of the follicles form the corpus luteum. It secretes the progesterone hormone. What is the role of progesterone hormone? To prepare the endometrium area in uterus for the implantation of embryo. Is it clear? So this progesterone also have one of the most important role. The endocrine glands start to secretion in endometrium area under the influence of this progesterone, and this endometrium is ready or prepared for the implantation of embryo. If the oocyte is not fertilized, the corpus luteum become inactive and to form the corpus albicans. Due to this, secretion of progesterone and estrogen stop. And that's why the endometrium become degenerate. This degenerated endometrium tissue and unfertilized eggs, okay, discarded throughout the vagina, it accommodates the bleeding. This bleeding continuous approximately 5 days. That is called as menstruation. So the menstruation is simply defined as it's a natural process The degenerated endometrium tissue and unfertilized ovum or eggs discarded along with the blood through the vagina. It is called as menstruation. Is it clear? Oh, stop. The reproduction and mononucleation. Many couples have the problem of the children due to the various reasons. Okay, there are the several reasons behind the childless couple. Especially in women, there is an obstacle in oviduct. Is one of the most important reasons behind this. Second reason is that there is a problem of implantation, embryo implantation in uterus and irregularity in menstrual cycle. These are the three main reasons, especially in women, behind the childless. In men, the less sperm count or deficiency of sperm in semen or completely absence of sperm in semen. Now, there are the several techniques, medical techniques like IVF, surrogacy, sperm bank. The childless couple can have the child. Now, let us see one by one each in detail. First is the in vitro fertilization. In vitro fertilization. It is abbreviated by IVF. It is abbreviated by IVF. Now, look at this picture. This is the ovum. This is the needle. With the help of needle, this ovum is sucked from the ovary of the woman who suffer from the obstacle in oviduct. This technique is used as when the fertilization, actually what happens in this technique, the fertilization is brought about in the test tube and the embryo is formed and implanted in the uterus of the woman at appropriate time. Okay, IVF technique is used for having the child in case of the childless couple who have the problem like obstacle in oviduct and less sperm count or absence of sperm in semen of the male. Okay, now let us second technique, that is surrogacy. Some women have the problem in implantation of embryo in uterus. Such women can take the help of the modern medical technique. Actually, what happens there? That is called as surrogacy. Actually, what happens in surrogacy? In this technique, oocyte is collected from such women who have the problem of implantation of embryo in uterus. This oocyte is fertilized in the test tube with the help of sperms. This sperm is collected from her husband. After fertilization, this fertilized eggs or ovum or zygote is implanted in uterus of some women who have the normal uterus. Such women is called as surrogate. Surrogate